So if you have a major invasive surgery that can help you to survive an emergency situation, you have now a responsibility to begin to take care of the causes of this problem. Because these diseases don't just happen to just kind of blue air. They have been carefully structured, they have been carefully grown by our lifestyle. And so it is incumbent on us to work with our medical colleagues to begin to extend the potential benefits of a major invasive surgery. We can also take a look at angioplasties. You've heard of stenting, haven't you? And here again, we have over 1.5 million stenting procedures a year, average cost $30,000, $40,000, and yet 50% of these stents are no longer functional within 6 months. So you have to do them again, because you really have not taken care of the underlying problem. And when you have a narrowing of the coronary arteries, you can almost be assured that you will have some narrowing of the arteries to the mind, to the brain, to the male sex organ, to the kidney vessels. It's everywhere. Do you have any idea how many miles of blood vessels are found in the human body? Anybody wants to volunteer? 5 miles? 10 miles of blood vessels? 100 miles of blood vessels? 5,000 miles of blood vessels per body? How about 60,000 miles per body? 60,000 miles. And the average vessel is smaller than the thickness of your hair, because it has to feed every one of those 100 trillion cells that make up our bodies. We are fearfully and wonderfully made. We're made the ultimate design. We are first class in design, and I don't think that we should put second class food into our systems to occlude them. If it's not surgery, then we have some great expectations that medication will take care of all these problems. I have a young internist son-in-law, and you know, he has all the ideas, and he has this concept that for every ill, there is a pill. And he can do a very good job to diagnose the illness. He tells me, he said, Dad, he said, in medical practice today, we have about 6, 7, 8 minutes for diagnosing a disease. I can diagnose it very well, and then we match it with a pill to take care of problems. And my concern is, how about side effects? I said to him, have you wondered about these side effects? He says, well, yeah, but we have some medications for the side effects. And I said, and those drugs now have new side effects, right? So you have another medication. And I said, isn't it amazing that many people have 8 and more medications per person after the age of 50? And I said, do you realize that pharmacologists tell us that anytime you have more than 4 medications, you're over 50 years of age, more than 4 medications, we have no idea what side effects will emerge because of the interaction of these drugs. He was stunned, and he said, well, but patients expect these silver bullets. They really don't want to change. I mean, they don't really want to change their lifestyle and their diet. They rather have some surgical interventions. They want to have some medication. They think the answer is found in pharmacology. And sometimes it is. When it comes to these chronic diseases, we have to lower our expectations because we have to be concerned about side effects. And here you see, in our society here in North America, we have about 146,000 deaths from prescription drugs, which is 7% of all the deaths in our society, which means that prescription drugs are the number 4 cause of death. I'm talking about prescription drugs, side effects, or people may have not taken these medications accurately, or sometimes they may be overprescribed. But we're expecting doctors to prescribe these pills. As a matter of fact, we see all the ads in weekly magazines. We see it all described there. And we say, yeah, this is what's wrong with me. I need to have this drug. And you go and see a physician, and you have now a cultural expectation. You want these medications because you figure that's going to be the answer for you. And sometimes you might have a runny nose, which is related to a virus most of the time. But you have somehow gotten the idea that if I just get that antibiotic, I'm going to be all right in a week's time. And so the doctor says, well, really, this is caused by a virus, and a virus has there is no relationship to antibiotics. Antibiotics are not going to be affecting viruses. But you know what you want, and you figure, if you don't give me my medication, I'm going to see another doctor. I want this medication, and the doctor oftentimes doesn't know what to do. Expectations, cultural expectations. Like constipation. Nobody talks about it. We just quietly suffer. We squeeze and we press, we do all kinds of things. When we have one bowel movement a week, we are excited about it. And so we think if we just had that medication, everything would be fine. All you have to do is increase your consumption of water. We all should have about 8, 9, 10 glasses of water a day. And get more fiber into your diet. Eat more real food. The fiber will hold the water in the system, and everything is going to be very, very nicely, smoothly coming out where it should be. And you have a bowel movement every day. You go into the bathroom, you sit down, and you're gone, you're done. You no longer have to squeeze and press and do all these kind of things. It's so simple sometimes that we don't take it seriously. 2/3 of all the hemorrhoidectomies, surgeries for hemorrhoids, could be taken care of within 3 weeks just by increasing fiber content and water. Too simple. From pills to peas. Simple lifestyle changes. Very, very powerful. But you see here, we are becoming more and more sold on the idea that we need to have medication to take care of our chronic diseases. Here you see that 28% of seniors take 5 or more drugs every day. We have sometimes patients that are taking 25, 30 medications a day. I mean, the bottles are not just sitting on the windowsill. No, they actually have, for Monday, so many drugs. For Tuesday, they're all in little special bottles so that you don't miss a drug. And again, we have this idea that for every ill, there's a pill, and that we believe that health is a result of medicalization. But this kind of an approach has its own set of problems to take care of. There's a price to be paid, not just in money, but also price in health outcomes because of interactions of these drugs. Because we are looking for medications that are usually accepted, oftentimes without proper assessment long term. Oh yes, a new drug comes out, they've done some of the research, it has taken 10, 15 years to develop these drugs, and now they're being used in different phases on different populations, and after 1 year we feel satisfied, the FDA approves it, and we think everything is all right, and then long-term studies 3 years later, all of a sudden we begin to realize there are side effects we did not assess long-term, and the drugs quietly disappear after they've sold billions of dollars worth in those first 3 years. So medicine, medical technology oftentimes kicks in. When you look at this big arrow here, you see that oftentimes we develop some symptoms. We have angina pectoris. We have a pain in our chest. And we now see a physician. You want to know what is causing this problem. Is this just some hard burn because you had too much pizza last night? Or is this a real problem like heart disease? And so now medical care can kick in, make you feel more comfortable. We can prescribe for you a nitroglycerin. You take them whenever you have that elephant sitting on your chest painful. You're walking up the stairs. You feel the pain. It's closing in on you. You take some nitroglycerin in 3-4 minutes. You can breathe again, and you feel so much better.